Hi, my name is Brendan, and today I'm going to be giving my presentation on the chronic inflammatory disease known as chronic inflammatory demyelinating polyradiculoneuropathy. The reason that I chose this topic for my presentation was because it was something that one of my friends suffered through most of our freshman year of high school, so it's just something that I have done a lot of research on, so it's just something I want to present with people. So CIDP is a chronic inflammation disorder that primarily affects the myelin sheath of the peripheral nervous system. And what it does essentially is that the immune system perceives the myelin sheath as something that is not produced in the body, and it begins to destroy the sheath around the nervous system. The diagnostic process of this disorder is lengthy and extensive and can include MRIs, ultrasounds, blood work, and other diagnostic workups. However, scientists have discovered some treatments that are often lifelong, as it is typically a chronic, lifelong illness. And these were discussed in the journal Atypical CIDP Diagnostic Criteria, Progression, and Treatment Response from the Journal of Neurology, Neurosurgery, and Psychiatry. Part of the diagnostic process of diagnosing someone with CIDP is difficult because it can mirror symptoms of other disorders such as Guillain-Barré syndrome, and because of this, the criteria to fit into the category of CIDP is extremely rigorous. Some of the mandatory criteria for evaluation includes increased distal motor latency, which is like delay in your distal extremities, which is like your arms and your legs. And that includes working its way up from there. As well as symmetric sensorimotor symptoms, which means symmetric means that it happens in both parts of the body and that it's sensorimotor, so you have issues with detecting things and carrying out motions with that. Also accepted symptoms were pain, weakness, and tremors, which is also all part of the symmetric sensorimotor symptoms. Some of the more severe involvement included the cranial nerve, which would present as vision issues, heart or digestive symptoms, hearing or facial issues. With this information, the following tests would be run by the doctors. They would do an MRI to check for any brain abnormalities or any abnormalities in the nervous system. A cerebrospinal fluid puncture, which is the fluid that nourishes the brain and spinal cord so it doesn't dry out. And then an EMG, which is used to check muscle movement in your body. And then from there on, with the results of the MRI, people with CIDP were found to have hypertrophy, which is enlarged cells in the cauda eschina, lumbosacral, or cervical nerve roots, which would all include show inflammation in the peripheral nervous system. When they would do the cerebrospinal fluid tap, they would check for elevated enzymes, infection, but the ultimate diagnostic process would be elevated proteins. Because of the inflammation, your body will release extra proteins. And finally, when they run the electromyography, which is also the other name for the EMG, if the sensory functions were still active, then diagnosis and progression may proceed in determination with the guidelines set in place by the EFNS and PNS, which is like nervous system guidelines for diagnostic treatments. And then the two treatments that they use for typical and atypical are either steroids or intravenous immunoglobulins, which are used to suppress the body's immune system and will over time help reverse the effects of the progression of it and help to prevent them from happening in the future. And there are four categories of CIDP, which is distal acquired demyelinating sensorimotor neuropathy, also known as DADS, which is the least bad. And then there's Lewis-Sumner syndrome, which is a more fartherly progressed. And then the last two is purely sensory and purely motor CIDP. Purely sensory is, of course, the worst, and in terms of progression, obviously. So starting from the end of that scale and working forward, the treatments will tend to have better effects if it's not progressed as far. So in the end, if you experiencing any of these symptoms, obviously bring it up with your doctor, but like I said, it is misdiagnosed a lot of the time, so stay safe.